Hello and welcome to our virtual allied health information session. We're so glad that you're interested in one of our programs and hope this can be helpful. We do offer an in-person information session once a month. It's on the third Thursday of every month from 5 to 6 p.m. at the Table Rock campus. We're located in the Health Professions building there, so 5 to 6 p.m. third Thursday if you prefer to come in person. You can get all the same information that you would watching this video. We're going to cover some soft skills for the healthcare careers. We will go over our programs, talk about the steps to get started, and finish with some frequently asked questions. I do recommend, even if you have a certain program in mind that you're looking for information about, still to watch the entire video to learn the differences between the programs. It could potentially spark an interest in another one, or even maybe you know someone who might be interested in one of our other programs. The frequently asked questions will apply to several of the programs as well as the steps to get started. So be sure to listen to it all so you get all of the information and you don't miss something. Some of our programs do have an application code that I will give you. That's going to be required for to submit that application. So that shows us that you've watched this, that you know the information that we're sharing here. Well, let's get started. If you've not been to campus before, the Health Professions Center is located at our Table Rock campus in White City, and this is really the hub for our allied health programs. These have the equipment, the lab classrooms, really the hands-on portion of our programs. Some of the classes are going to be online, but the in-person ones are going to be here. As you get to campus, there's buildings on both sides at our RCC. We're the taller of the two with the big parking lot out front, and there is free parking. So nothing to worry about there, just find a spot. We do have RCC does have a campus in Grants Pass as well as Medford. So potentially you could be taking one of your general education classes there if you're closer to one of those locations. We do also have advising, academic advising and financial aid advising, and folks that can just help you fill out the general RCC admissions application at all three campuses. So you're welcome to drop in. You might hear the term hard skills versus soft skills when referring to a job. Hard skills would be the technical abilities that a person has. Typically, you learn these through an education or training program. Examples like operating a piece of equipment, completing a specific task, things like those. Soft skills, on the other hand, refer to the skills you learn over the course of your entire life. People often associate these with your personality or even habits that you have. So our hope is that these things describe you as you're considering a career in healthcare or continuing in the healthcare field. So first of all, like working with people, being able to handle a fast-paced environment, remaining calm under pressure. This is super important. A patient comes in, they're upset. Maybe they're going through a crisis. A lot of people have negative feelings associated with coming into a medical facility. So you are that face of calm for them. It's also very important to understand and respect diversity as you're working with a wide range of people. You will experience this in your classes with your classmates and instructors, as well as getting out into the field. Other skills would be to being able to take feedback well, communicating and behaving professionally, and then having empathy for people. These are the programs that we'll go over that are a part of the Allied Health Program. Basic healthcare, phlebotomy, medical assistant. We do also have a bridge program that's with our medical assistant program, administrative medical assistant, pharmacy tech, and dental assistant. So let's get started with basic healthcare. This is a certificate that's great for high school students, or if you're an adult learner who's considering a switch in your career to healthcare. This helps you get your prerequisites done for some of our other programs, as well as just giving you an introduction to seeing if you like it. We have a class called Exploring Careers in Healthcare, as well as other things you take would be medical terminology, biology of human body systems, get your first aid and CPR certification out of the way. So these things are really helpful to prepare you for your next step in a healthcare career. And this basic healthcare certificate has general classes that are offered all throughout different terms. So you can start this program at any point in the year. Our spring A spring term typically starts in April. Summer would then start in July. Fall would start towards the end of September. Winter would start in January. Typically, you can refer to our academic calendars for specific dates. It will take you about 2 terms to complete these classes, though, because it's 23 to 29 credits. The reason for the range there is your elective choices. And then our estimated cost here is calculated from our $120 a credit. That's our current in-state tuition rate plus the fees for courses and our college fees. If you are a high school student, this certificate is great because your high school could potentially pay for this. So you're not only saving money, but you're also getting ahead on classes and prerequisites for after graduation. And these classes in the certificate are offered online to offer that flexibility for your work or school schedule. The prerequisites for the basic healthcare certificate are CIS 120. That's our concepts in computing class. We do offer a computer proficiency exam option. You could test out of the class using with a passing score on that exam. You can talk to your advisor for more info on this, as well as Math 20 which is pre-algebra, and then reading and writing 90. These are very common prerequisites for a lot of our programs here at RCC. Next, we have our phlebotomy program. This program starts every fall and spring. It is 1 term in length, which is 11 weeks. And something to note, the length of the programs don't include the prerequisites. They're just the program courses. And the practicum will take place during the term. If you're not familiar with the term practicum, maybe the term internship or externship may be more familiar to you. Same idea, you're going to be placed out in the field at a local facility, getting hours and experience. Phlebotomy credits would be 13. Estimated cost is $2,174. And as a phlebotomist, you could be making in the $17 to $20 range starting off. And then phlebotomists work in all different settings. There's some at hospitals, labs. You could work for the Red Cross, even plasma centers or mobile sites. And this is a great entry point to just get your foot in the door. It's a quick training, getting you skilled up and working. Even if you are looking to, work your way into a different position or stay in the healthcare field and work towards another certification. Here are some photos from our phlebotomy classroom. It's very hands-on. You can see our students on the right-hand side working with our fake arms. You practice on the fake arms first, then you practice on each other, and then you practice on some volunteers that come in. The phlebotomy training moves, or a term I should say, moves quickly. You're in classes, you're learning a lot, and then you're going right into practicum. And it all prepares you to take your certified phlebotomy technician national exam afterward. Here are the prerequisites for the phlebotomy program: reading and writing 90, as well as your CPR card. We do offer a non-credit course here at RCC to get that certification, or you can go directly through the American Heart Association. Look for that BLS, which is the Basic Life Support CPR provider classes. If you do have a current card, please make sure that you check the expiration date to make sure it's still current. And then CIS 120 is another prerequisite for this program. However, that is one course you can take in the program if needed. The phlebotomy program requires an application. Once you submit that application and you are accepted, there is some additional requirements that we will give you the instructions for at your orientation. So the cohort of students that are all starting the program together will have an orientation, and we'll go over this, but I just want to be upfront with you that there will be a fee associated with this documentation prior to the start of the term. It's an $83 fee, and you would upload your current immunizations, upload proof of your CPR card, and then it will initiate the background check with that fee that you pay. Just to note that's coming. I will show you the list of immunizations, so you can take a look at that now ahead of time so you can plan ahead if you need to get something that you don't have or locate your records. For the phlebotomy application, here is your code on the right-hand side in red, lowercase the word scrubs. Go ahead and write that down. You'll need that for the application. And then there is another requirement for a drug screen. This will take place prior to your practicum. You'll get a notification that you'll have 72 hours to go in and complete the drug screen. There won't be any fees associated with it. You just go in to a certain location, get it done, and then we get the results to make sure you're eligible to continue and to be in your practicum. To locate the phlebotomy application, look to the right-hand side at our menu. Under Allied Health Program Information, look for the How to Apply page and scroll down until you see the application links I've marked here with a blue arrow. Our dental medical assistant phlebotomy is all the same form. You can click that, put in your code, and apply. Keep an eye out also on this page for the dates for the applications. We really encourage you to apply early, and then we have deadlines for these applications because we have to have time to do your orientation and give you time to complete that additional documentation I mentioned. Next, we have our medical assistant program. So this program is offered every fall and spring. It is 3 terms in length, and the practicum takes place during the last term. That's that internship piece where you are out in the field at a local facility getting hours. There is 45 to 48 credits to complete this program. Estimated cost is $6,500. As a medical assistant, you could be working in a variety of different offices and clinics in work and making something off the bat from $18 to $24 an hour. Here are some pictures from our medical assistant lab. It's set up just like a doctor's office, very realistic, taking your patient's height and weight, doing everything that you would on the job. Our medical assistant prerequisites are listed here. I've highlighted the Math 60 and 63 because that is the class that has to be done and passed prior to starting the program. The other ones listed here can be taken during the program. However, we do very strongly encourage you to still take them ahead of time. They're prerequisites for a reason, meaning they're giving you those skills you need to be successful in your program courses. So it will also add to your load if you opt to take them in the program. You'll have a lot more credits per term. However, we do allow students to take those classes in the term or in the program. Math 60 and 63, though, just has to be done and passed. The medical assistant program does have an application. So after you submit that application and are accepted, we will have an orientation where we'll give you all of the information to complete this additional documentation. Just like phlebotomy, there will be an $83 fee right before the start of the term to complete this. This will initiate a background check for us, as well as a place to upload your CPR and first aid card, your immunizations, and get you all set up. So that will be coming. I just do like to let people know about that fee because it comes before the term starts. Potentially your financial aid may not cover it. So just to plan for that. And then prior to your practicum, we will do a random urine drug screen. We will notify you that you need to complete that within a 72-hour window. And just know that that's coming as well. Here is your code for the application. All lowercase, the word scrubs. You will need that for your application for the medical assistant program. To find the application, look to the right-hand side and find the How to Apply page and scroll down where you see the links for the application. I've highlighted them here with that blue arrow, and you can use that code I gave you to apply. Keep an eye out for the dates as well. Those people that submit an application before the priority deadline definitely get priority. We want to make sure we give you increase your chances to get a spot in the program by applying early. And then even if you're still working on prerequisites, that's totally fine. We want you to apply early as you're working to complete those. We can always verify your grades later on to confirm you're good to go. Next, we have our Medical Assistant Bridge program. So this would be designed if you're currently working as an administrative medical assistant. This could be like a front desk receptionist, a medical office assistant, a patient services representative. There could be a lot of position names, but someone in that job setting wanting to become a certified medical assistant. So this is designed for you to continue to work at your current employer, but it's an abbreviated program because you already have some of that experience. It starts every fall and spring. It's still 3 terms in length, but the credit load is a lot less than our traditional medical assistant full program. And then there will be a practicum element still in that last term. The bridge program prerequisites are reading and writing 90 still. We do also require that you have a minimum of 500 hours as a medical front desk receptionist. You also need to be eligible for this program, have experience with scheduling, patient check-in, telecommunications, customer service, working with electronic health records, knowledge of insurance and basic billing functions are really important. And something that I didn't mention about our medical assistant programs, just going back here, is um, some people don't realize that the phlebotomy element is actually built into the medical assistant program. And so, um, as we're thinking about some of these things here, so our medical assistant program does prepare you to take your certified medical assistant exam, but also to take your certified phlebotomy technician exam and your certified ECG technician exam. So something to note that phlebotomy is actually a part of the medical assistant program. As I'm talking about the medical assistant bridge program, remember this is that abbreviated program because these are the currently employed administrative medical assistants. Because you're working at your current employer and partnering with them through this program, we do also, along with the program application, require that you have a signed training agreement. This is an agreement between your employer, RCC, and you. Um, you can find that on next to the application, as well as look at the medical assistant bridge page of our website. And then we also ask for 2 letters of recommendation. This can be from a current or previous employer. And that signed agreement, as well as your letters of recommendation, can just be emailed to us. You can find our email, alliedhealthinfo@roguecc.edu, right on the website. I'll also give you contact info at the end of this session. After acceptance, you will receive orientation information where we will go over all of the additional documentation you will need prior to starting the term. That will come with an $83 fee. That initiates a background check and will create an account for you to upload everything you need to from your CPR, first aid, vaccines. You'll get instructions for that, but I just want to let you know that's coming once you're accepted. And then prior to your practicum, there will be a random drug screen that you'll need to go in and complete. Though that won't have a fee associated with it, but it will appear randomly and you'll have 72 hours to get it done. That will be notified. You'll be notified via email on that. To find the bridge application, it is also located on our How to Apply page. Look at the menu to the right-hand side of this website and then scroll down till you find our application links, and there's one listed there for the bridge. Next, we have our Administrative Medical Assistant program. This was formerly known as Medical Office Assistant. You can complete this in the fall, winter, or spring terms. It is just 1 term, which is 11 weeks, and can be completed all online. So we've all walked into a medical facility. You see that person at the front desk greeting you, checking you in, helping you schedule when you go to leave. These folks do, need quite a bit of customer service skills. You're really that first face of the office, that first impression for patients. And you could be working in a variety of settings at a hospital, clinic, even specialty offices, making somewhere in the $16 to $20 hour range, most likely starting off. To complete this program, it's 15 to 21 credits. And like I said, you can complete it all online, so there's flexibility with your schedule. The prerequisites are reading and writing 90. And there is not a separate application for this. So if you have a current RCC student ID number, you can go directly to advising. You can meet with an academic and career coach at any campus. Just drop in, you don't need an appointment, and they can help you with a program plan and clear you to register. Next up, we have pharmacy technician. This program starts in the winter and is 2 terms long. That practicum will take place during the last term. You'll be out in the field at a local facility getting a hands-on training. It is 31 credits. Estimated cost $4,189. That's from our in-state tuition, which is $120 a credit plus the fees. As a pharmacy tech, you could be making $16 to $22 an hour. You could be working in a hospital pharmacy. You could also be working in retail pharmacy, things like CVS or Walgreens, where they have their pharmacies. The pharmacy tech program really is a big load. The first term is 17 credits, so we do need all your prerequisites to be done ahead of time. There's not room in your schedule to try to add these on during the program. So Math 20, CIS 120, HE 252 is our first aid and CPR. And then your writing needs to be done. Writing 115 or BT 113 can cover that. There is not a separate application though for pharmacy tech, so you can go directly to advising. You can drop into any of our 3 campuses to meet with an academic and career coach. They can give you a program plan and clear you to register. Pharmacy tech will have additional documentation like our phlebotomy and medical assistant programs do. However, you will get instructions for this during your first week of class. So know that it is coming still. You'll have to pay the fee, $83 to initiate a criminal background check for us and upload proof of your vaccines, first aid, CPR. But you'll get instructions when you start it. So no application, you can go directly to advising and get all registered for classes. Prior to your practicum during the second term, you will receive that random drug screen just like our other programs that you'll need to complete. There won't be anything to pay for that. You just need to know that it's coming so that you can get it done. Finally, we have our dental assistant program. So this is the longest of our allied health programs. It is 1 year. It starts every summer, and the practicum will take place during the last 2 terms. Since it's a longer program, it's more credits and costs more. If you have questions about financial aid, though, I'm going to give you some contact information at the end. You could be making $18 to $24 an hour, working in a variety of places, depending on the dental office that you work for. Here is a look inside of the dental lab, though, at our Health Profession Center. This looks very much just like a dental office. Your state-of-the-art equipment, you're going to get all prepared to use the same type of equipment you will use in your practicum, as well as when you start your job. It's very, very hands-on. Dental assistant, you do need to complete all of these prerequisites prior to starting the program. That way you're all set up for the rest of your classes once you start. There will be a dental assistant application. Once you're accepted, you will have that orientation, just like some of our other programs, so that you can get instructions for these additional documentation pieces. It is $83, and that will initiate a criminal background check, and you'll create an account with the instructions we give you to upload your proof of immunizations and your current CPR and first aid card. Prior to your practicum as well for dental, you will be notified you need to complete a random urine drug screen. Go into a local facility. We'll give you the instructions for it to complete that to be all set up. Here is your code for the dental assistant application, lowercase all scrubs. To find the dental application, it's in the same spot as MA and phlebotomy. Find the How to Apply page and scroll down until you see those application links there. Now, we do want to take a moment to talk a little bit about your responsibility as a student. First thing to note would be we do have some legal compliance here. We are a healthcare training facility, and so the state of Oregon has some standards and rules that we need to comply by. This is involving your placement into your practicum. So things like needing the criminal background check, the drug screen, making sure our immunizations are in place. Those things are standardized and set by the state of Oregon to make sure that all of the healthcare training facilities are operating by the same standards. So some of those things that we're talking about are coming from that legal compliance. The next thing to note would be we do have a dress code for our programs. You are required to wear a certain color of scrubs, and you'll get that information when you are accepted and you have your orientation. And that will be required to wear to your lecture as well as your lab classes. We also ask that you have a positive attitude towards learning. There's a lot to learn. Some of our programs move quickly, but we're working together with you. We really want you to be successful. We want to help you along the way, even through the admissions process and applying and all of that. So reach out to us with questions, have a positive attitude so that we can work together and help you be successful and learn as much as you can while you're here. And once again, I want to emphasize the professional behavior and communication is so, so important. It might be intimidating going into your practicum, working with patients and coworkers and all of that, but you'll be getting practice communicating with your instructor and working with your classmates that you'll develop those habits that will help you be successful in the field. But just knowing that that's part of the process, learning those and acting as professional as possible. Here's a helpful outline of all the steps to get started. So right now you're in step 1. You're watching this video, so that's you attending an information session. If you are new to RCC, meaning you don't have a student ID number, your next step would be to complete the RCC admissions process as well as placement. I'll talk about that on the next slide. If you do have an RCC student ID number, even if you can't remember the ID number, but you know you've taken a class here, we can help you look that up. But you can skip then to step 3 and stop by one of our 3 campuses to meet with our academic and career coaches. You can also email or call them. I'll give you their info at the end. They can help you make a program plan and map out your classes and clear you to register. Now, all of our students at RCC are required to meet with an advisor before they're cleared to register. That ensures that you're in the right classes, you're where you need to be, and you're not just registering accidentally for something incorrect. Step 4 through 6 is only for our MA, bridge, dental, or phlebotomy programs, because those are the ones that have applications. So your next step would be submitting an application, awaiting your acceptance letter, and then attending your orientation. We would give you that info in your acceptance. Those of you interested in pharmacy tech or administrative medical assistant, you would skip those because there's no application. You can go right from step 3 to step 7 to register for your classes. Some of our classes do have permission codes, so that's why your academic and career coach is important to help you make sure you have everything you need for registering. And then step 8 would be those additional documentation pieces I mentioned, like uploading your immunizations, background check, you'd get instructions for. If you're not currently an RCC student and you've never been, you don't even have a student ID number, your job first is to apply online. So you just want to go to our recruitment page. You can search that in the search box or go to this link here and hit the Apply Today button. You will receive an email with your student ID number and your next steps, which will be placement. Placement is really important in the process because you can either take a formal placement assessment or complete our self-guided form on the placement page of the recruitment page at roguecc.edu. But this gives you a math, reading, and writing placement to ensure that you're placed in the right prerequisites or potentially waived from them. If you do have previous credits, you can email in your transcripts also. So recruitment at roguecc.edu is where you can send your transcripts. That's going to be an important step then before you apply to one of our specific programs. As I mentioned, after placement, you will need to meet with an academic and career coach in order to be cleared to register for classes. Moving on to some frequently asked questions, where would you find your program's prerequisites or required classes? So this is a helpful spot to actually find your program map. If you go to the main RCC website, look at the very top and click on Programs of Study on the black bar. Scroll down to the Health Professions pathway and look for the specific program. It outlines all the prerequisites and the classes you would take term by term, lays it out very nicely. Another common question is, do you need to complete your prerequisites before you apply to the program? So no, we really want to encourage you to apply early. Even if you're still working on your prerequisites, that is totally fine. We want you to apply early And then we just want to make sure you have a plan in place to complete those. Are courses offered online? Yes, some are. The easiest way to check would be first looking up your program map where I just showed you how to find it and look for those course numbers. So for example, AH100 is our medical terminology class. You could then click on the schedule of classes at the very top of the website. I've highlighted that here. And then search by course title or course name. You can search term by term and see that the offerings of classes. If it says distance learning or web-based, those would indicate that they are online. The in-person, especially like the lab classes where you're hands-on in one of our lab classrooms, those would be at our Table Rock campus in White City. Some classes are just offered online, and some might have an option for in-person or online. Another question is, can you complete a program part-time? So the short answer is yes, part-time can be done. This would be a great conversation to have with your academic and career coach. On the program maps that I just showed you, how you can find it on our website, there are some notes by some of them that say can be taken outside of cohort. So those indicate that you can take them in different terms to help you complete the program at a pace you need. So talk to your advisor with more questions, but that's just a helpful way if you're looking at it to potentially map it out at a slower pace for part-time. Here are the required vaccinations. Um, you will get instructions of where you need to upload this once you've been accepted, but take a look at the list now to see if there's something you're missing. You want to make sure you can find that record because even if you know you've had it, but you don't have record of it to show us, you're going to need to get a titer test to show that you've had that vaccination. And that can take time to schedule an appointment, have your doctor order those tests. So take a look at it. You can find them on the program requirements page to the right-hand side of our menu here. We do have exemption forms for the COVID-19 vaccination, and we have declination forms for a flu you can get from us later on at your orientation. I know I've showed you how to apply for each of the programs, but just want to reiterate, if you are applying for dental, medical assistant, the bridge program, or phlebotomy, go to how to apply on the right-hand side and scroll down to the links. If you are interested in administrative medical assistant or pharmacy tech, there is no application. So after watching this video, you can go to advising and talk about a program plan with your advisor. For the programs that do have an application, there is an essay question portion. So I just want to give you a couple tips. Here are the questions it will ask you in this personal statement. And really, this is your chance for us to get to know you. So we want to know why you're applying, what are your goals, what kind of experience you potentially bring with you. Really, it's your chance to share with us. And it's also can be a great opportunity if you've been maybe something happened recently that in your personal life, something challenging and that impacted your schoolwork, maybe you failed a class or two, you can explain what was going on and give us a little bit more information about that. And then express to us how you plan to be successful going forward. So it's really an opportunity for you to share what you would like there. But part of the scoring that we do on this application is, did you answer all of the questions? So make sure you do that, be complete, proofread to make sure everything looks good. When you go ahead and click on the application and open it up, you read through it all first. And I really recommend that you type it up separately, this essay piece. Open up a Word document, type it all out so that you can make sure you're in the word count. But also the application session tends to time out every 2 hours. Not necessarily will take you that long to complete, but you'd hate to be working on it, get interrupted, and you've left your computer open and nothing's saved. So just to save you all of that trouble, do it separately and just copy and paste it in when you're ready. You will be notified by your student email if you are accepted. So be sure to be setting up that email if you haven't yet. If you're not sure how, take a look at our website on the Computer Lab FAQs page. They do have some instructions about setting up your student email. And then you need to reply to that email to confirm that you would like that spot in the program. That way we know to plan for you. And I know we've talked just specifically about allied health, but we do have other healthcare related programs here at RCC. We do have a community health worker non-credit training. We have emergency services and paramedics, as well as massage therapy, nursing, including RN and LPN. Nursing assistant, this training prepares you to take the CNA exam. And then we have occupational therapy assistant. That's really through Lynn Benton Community College. We partner with them to offer that here on site, as well as physical therapy assistant. It's a program through Lane Community College, but we offer it on site at our Table Rock campus. So if you have questions, check out the website for these programs, as well as talking with your academic advisor. We also have online trainings through our community education department. It's through a platform called Ed2Go. So these online classes do have some healthcare topics, including a medical billing training, a vet assistant, Spanish for medical professionals, and healthcare entrepreneurship. These are great also even for professional development. And finally, I'm just going to end with our contact information. So if you have questions specifically about the application process, placement, or general program information, reach out directly to us here at Allied Health Info at roguecc.edu. You can also give us a call. If you have questions more related to classes or registering, the best place to go would be academic advising. So drop into any campus to speak with an academic and career coach, or you can reach out with their contact information here. If you have questions specifically about dental assistant, you could reach out directly to our program advisor, Carmen Mons. If you have financial aid questions, the first thing to do would be make sure your FAFSA is filled out. That is the federal application for financial aid. Our TRIO department has appointments you can book right there on their Calendly link to actually help you fill out that FAFSA together. If you filled out your FAFSA or you're not planning on using financial aid, or you just have some other questions, you can drop in to our campuses also for financial aid advising. Reach out to them to help you. Even if you're looking for scholarship opportunities, they have some more information they can give you to make sure you can pay for it. So we're so excited and we're here to help you get started. So please reach out with any questions and we look forward to potentially meeting you and just helping you along the way. Thanks for watching, and you're all set to now move forward on your next steps.